hospital. دكتورة نيكولا. دكتورة نيكولاي. This is the place of your hospital. And this is the...
Dear colleagues, I would like to present a project of my professor NIKOLAI NELASSOV and his team from Rostov State Medical University in Russia. The name of project is Utilization of Sonographic Quantitative Techniques for Detection of Steatosis in Patients with Non-Alcoholic Fatty Liver Disease from Northern Caucasus region. Non-alcoholic fatty liver disease is defined as the fatty infiltration of the hepatocytes exceeding 5% of the liver weight in the absence of other causes such as excessive alcoholic intake or hepatitis C. Estimates of the worldwide prevalence of non-alcoholic fatty liver disease range from 6 to 33%, with a median of 20% in the general population. Although liver biopsy is the gold standard for diagnosing of non-alcoholic fatty liver disease, it is not the method of choice to be used in studies that involve general population due to its invasiveness and costs. Ultrasonography as an alternative tool is non-invasive, relatively inexpensive, and widely available and increasingly accepted as a method for the initial screening of patients suspected to have non-alcoholic fatty liver disease. Sonographic attenuation and scatter distribution coefficients have been shown earlier to have excellent diagnostic accuracy for detecting of hepatic steatosis. The cutoff values of these coefficients for optimal separation of subjects without and with steatosis were determined for Korean population. The aim of our study was to determine the cutoff values of sonographic attenuation and scatter distribution coefficients and analyze sensitivity and specificity of TAI and TSI in detection of steatosis in patients from Northern Caucasus region with non-alcoholic fatty liver disease. The presence of steatosis in patients with non-alcoholic fatty liver disease was determined according to clinical, laboratory, and ultrasound data, including Bedoni fatty liver index and BMOD Hamaguchi scoring system. 22 subjects, male 9, mean age 46, without clinical and instrumental signs of steatosis. The first group, Hamaguchi scores is less than 2. And 19 subjects, male 11, mean age 56, with steatosis signs. Second group, Hamaguchi score more than 2, underwent ultrasonographic exam with evaluation of tissue attenuation imaging and tissue scatter distribution imaging. TAI and TSI were registered during calm breathing. In the exhalation phase, we used the manufacturer predefined BMOD presets, right intercostal approach, and position standard sampling box in the hepatic parenchyma at least 2 cm below the liver capsule, while avoiding areas with large vessels and reverberation artifacts or shadowing. The measurements were repeated 3 times, and average values of the coefficients were calculated. Receiver operating characteristic analysis was used, and cutoff values of tissue attenuation imaging and tissue scatter distribution imaging in identification of steatosis were determined. Mean values of TAI in first and second groups were 0.57 and 0.78, and of TSI 80.1 and 98, respectively. The cutoff values of TAI was more than 0.64 and TSI more than 92. Differentiated subjects of first from second group. Area under the curve parameter in both cases was equal to 0.98. To sum up, sonographic tissue attenuation imaging and tissue scatter distribution coefficients are effective in detection of steatosis in patients with non-alcoholic fatty liver disease. The cutoff values of tissue attenuation imaging and tissue scatter distribution imaging in detection of steatosis for ultrasound machine RS-85 and subjects from Northern Caucasus region were determined. Thank you for your attention. If you have any questions, you can ask them to Professor NELASSOV via email. Thank you.
Okay. Any questions to, I can ask you, Dr. and NIKOLAI? I can ask you questions?
Maybe Professor.
Or Professor is here?
I don't know.
I have
Okay,
a question.
perhaps.
Thank you, NIKOLAI, for this nice presentation. I wanted to ask, did you compare, you did compared ultrasound with the lab, did you compare with MRI or with liver biopsy?
Not, these patients were not underwent liver biopsy or MRI. We make only laboratory and clinical
and ultrasound.
analysis.
Well, I would recommend in the next phase you should go for a liver biopsy and an MRI fat assessment. It would give more deep results in this study.
Thank you.
Any other question? I will ask you one question. You detect cutoff value of that there is liver steatosis, okay? But can you determine the degree of steatosis by this technique? First degree or second degree or third degree of steatosis? Because steatosis is arranged in different degrees and different machines tell us that this is grade 1, grade 2, grade, yeah. This can done by your, yeah, okay.
We make only cutoff value of presence of steatosis or not steatosis. Only the presence of steatosis to cutoff value.
Only detection.
Detection, yes.
Any other questions? Thank you very much.
Thank you.
Now finish the first session and thank you for all audience and for presenters and see you in the next sessions, inshallah.